In the complete hemodialysis series, we have seen about various complications a dialysis patient can develop. In that, today we will see regarding headache during dialysis. Many times in the dialysis unit, you might have seen the patient as soon as dialysis started. Within 10-20 minutes, the patient might start developing headache. It is very common. Up to 50% of the patient can develop this. To know the etiology, the headache can be are of two types. One is specific to dialysis, one is non-specific. What is that non-specific? That means a patient can have any general condition which is causing headache. During dialysis, that same one only the patient is having. For example, a migraine attack. For example, a high BP. These are general things. Any situation which causes headache in a general patient. For that, how to find out? We have to ask the history whether in the non-dialysis days whether patient is having that headache or not. How frequent it is. Once the dialysis is closed, whether he is having headache or not. How long the headache persists, or is the problem occurring only during dialysis? History is very important. So let us come to the specific ones. Let us rule out non-specific ones or the generalized ones which needs the similar treatment similar to a general management of headache like migraine, for example. Now coming to the specific ones. Headache, the patient is saying and developing headache only during dialysis, not on other days. What are all the reasons it could be? First, it could be a subtle manifestation of dialyzer reaction. It could be a manifestation of severe one, which is dialysis disequilibrium syndrome. Before the patient develops the severe form, it might start with mild headache. Third one, electrolyte abnormalities, magnesium deficiency and also hyponatremia. Common, so magnesium level we have to check. Fourth, blood pressure. In a dialysis unit where 100 dialysis are occurring over a period of 1 week, if a patient, n number of patients are developing headache, around 70% might be having high BP only. During dialysis, BP shoots up. Because of this, patient develop headache. Because that might be the first manifestation. A high BP, patient is developing headache. These are specific things, especially during dialysis. These are common. What are all the rare ones? Hemolysis, air embolism. This hemolysis air embolism is very rare, but this can also initially start with headache. So these are the varied causes of headache in dialysis unit. Another parameter we have to notice at what time it is occurring, after 2 hours of dialysis or immediately after dialysis or at the end of the dialysis. This we have to see. So what we have asked the history, we have known specific and non-specific causes. We know it is occurring after, for example, 30 minutes. How to manage? Blood pressure have to be checked. The vitals have to be monitored. If blood pressure is under control, even if it is a dialyzer reaction, that will come under control. So these are the overall etiologies we have seen. And how to manage? You have to target the etiology only. If it is a dialyzer reaction, there are two types of reaction as we discussed in the previous videos that have to be targeted. Probably for some time, if the headache is very severe, for some time you might have to put the blood into circulation. Take the blood or the blood whichever in the circuit, not to return back to the patient, just put it in the circulation. Give some gap. Make sure BP is under control. Check the sugar also. Many a times a patient who is in empty stomach might also develop. These are patient specific. Some patient says that without coffee I definitely will develop headache. If it is so, probably as per the patient specific parameter also you have to notice. These are all things which might not be there in the textbook. Patient specific parameters we have to ask. Dialyzer reaction have to be taken care of. BP have to be brought under control. If all these are done, despite that patient is having headache, what to do? Paracetamol. Simple paracetamol is more than enough. Or a migraine treatment trial can be given. These are the treatment approach. One important parameter at this point of time is if the headache is gradually worsening, dialysis better to stop for some time, because a simple headache which is non-specific, no specific etiology, only occurring during dialysis, give a gap, give paracetamol, it will resolve. If it is gradually worsening, you are not knowing the etiology, just put it in circulation for some time. One more parameter with respect to the treatment of hypertension is nitroglycerin. Whenever BP goes high towards 180, most of the dialysis doctor or MD resident will start the patient on nitroglycerin. Nitroglycerin after 24 hours, it is bound to cause headache, but there are some patients who have exaggerated response to nitroglycerin. Cerebral vasodilation, severe headache will worsen. During that time, you have to avoid nitroglycerin and go to some other beta blocker. So drug always take into consideration. This is the base info related to headache during dialysis, how to manage. If you know the etiology, if it is non-specific, give paracetamol, it will resolve. So that's all for today. In another video, we'll see regarding yet another complication. Bye-bye.